Hi, my name's Tom, and I'm an East Asian medical practitioner here in Richland, Washington. Today, in our continuing series of working with all family members, today we're going to talk about pediatric patients. Now, you can actually do acupuncture with pediatrics. You just have to have patience, and you have to have an ability to work with them. I've worked with many pediatric patients, and I know that as a parent, it's hard to imagine putting a needle in a kid and going, oh my gosh, a needle. But these are very tiny needles, and they're very helpful to the patient as well. So we have a couple of choices in another segment we talked about Twina massage, which is an option that can be used as well. There are two other options. You can actually use the needle itself, or you can use what is described as non-needling techniques. So what we'll start with is we'll start with the needle. So depending on what's going on with the patient, whether you would determine the spot that it's going in. For today's purposes, I'm just going to put the needle in the patient so that you can see that it's not that big a deal. Are you ready? Okay. Now let me know how you feel, okay? I want you to be honest if this is going to hurt or not. Did that hurt?
Not really.
What did it feel like?
It felt like something was poking me.
So it just felt a small little poke, right? Okay. Well, you need to make sure that when you talk to the patient that you tell them not to move their arm, not to move their hands, not to move whatever the needle is in. So do not move. Do not squirm around, okay?
Don't squirm this arm around.
Don't squirm that arm around at all, okay? You need to make sure that the patient understands and that you live up to their level. Most of the time, you're only talking about 5-10 minutes for the needles maximum for a pediatric patient. So I'm going to remove this now, and that needle's going to sit there for right now as we go through this. So this is the non-needling techniques, and what it is it's a tool that you would use that you could press in on a spot and then you brush it off. You press in on a spot and you brush it off. How does that feel?
Like, kind of the same thing, just a little, something that's a little harder.
A little harder, so not as pokey, just a little harder? Okay. So you can brush off the spot with your hand, or you can brush it off with the tool. Either way, you have to make sure, you have to keep in mind that you have patience with the kids, and they have to be able to have tolerance of you. So, join us next time for another exciting episode here with the blog that I'm doing to help make you healthy, happy, and wise. I'm Tom. Have a good day.